As we know, many schools, libraries, activity centers are closed. So what's a kid supposed to do all day? Parents may think a play date is the answer, but according to the Cleveland Clinic, we need to use caution. News 2's Carolyn Murray has more.
Playdates, especially with younger kids, there is no way you can really provide supervision because they are playing in enclosed quarters, they are playing together close to each other, which is probably at this time in the virus we have in the current environment not a good idea.
Dr. Esper says when we cough into the open air, germs can travel 3 to 5 feet. Some germs stay airborne for a while, like measles, which can hang out in the air for hours. He says when we catch a cough in our hands, it may stop the cough, but then germs can spread if we touch objects and people. Dr. Esper recommends teaching children at a young age to cough like Dracula and tuck their nose into their elbow, just like Dracula wraps his face in his cape, so it becomes a habit. But he reminds parents that children will forget, so it's important to also teach them good hand-washing skills.
A lot of hard metal surfaces, the rates of contamination and the risk of exposure is exponentially higher. So I would advise that, go ahead, play, but if your kids are young enough that they potentially cannot follow the instructions of not touching everything, not washing their hands properly, then it's probably not a good idea.
That was Carolyn Murray reporting. Dr. Grover says children with a cold, congestion, cough, or fever should not be allowed to play with healthy siblings or other children.